There were four very basic things that we can say that AI will bring value to. First and foremost is going to be around 24/7 availability. We are not limited by staffing. We are not limited by ensuring that contact centers or telehealth centers are adequately staffed. Particularly, there being value if the underlying AI systems are well trained and they have the necessary safety guidelines as well as safety measures incorporated within them. The second thing is really around basic automation. A lot of times when we think about AI, we inevitably think about us having a very glorious and very sophisticated AI system. It doesn't have to be there. Even things that bring basic automation to the equation, that is also of tremendous value. Now that automation can be either on the operational side of the healthcare practice, or it could be also on the side of the of where the primary patient as well as practitioner interaction is happening. The third area where there is definitive value is around how triage is carried out in the healthcare space. Like, not everyone should end up in an emergency if they've got just a cold. There are basic things that AI can enable by performing basic triage on certain cases and thereby lowering the burden on healthcare practitioners and the availability of adequate staffing to really drive the sort of patient as well as human outcomes that we're all kind of talking about. And one major issue that keeps coming up time and again is around the issue of no-shows. This is a surprisingly major issue that we as VenD are also working to address. Is the patients going ahead, placing a booking, and then simply not showing up for the appointment. That wastes the time of the healthcare professionals, the administrative staff, not to mention the patient does not get the care that they need. That could be due to a variety of different reasons. But by having systems that are, let's say, conversationally driven, perform that validation with the patient ahead of the appointment itself, we can reduce such instances. Patients should and could feel an improved sense of humanness from the other side, that sense of empathy, dare I say, from such AI systems that help drive an improved sense of engagement and connectedness to the healthcare practice. And then finally, the second and final point is around, because the AI is fundamentally connected to a variety of different systems, it does allow us to improve the quality and personalization of the healthcare that is being provided to the patient, him or herself. So where previous history, as well as prior diagnostics and treatment can be brought into the equation, and at a very rich and multi-connected level, the suggestions can be made, rather accurate suggestions can be made to the healthcare practitioner as to what the next step in terms of that patient's journey should be. So these are some practical areas where benefits can be realized, and then finally what kind of impacts it can have in both patient and human outcomes.